I was in a smaller process.
All right, thank you very much for joining us today on the program, Healthy Living. I am Adesuwa Osa Owagie. Come 13th of October 2019, okay, it was actually yesterday, Sunday 13th October 2019, the world, celebrated World Thrombolysis Day. I hope I got that right, yes, World Thrombolysis Day. And more than 2,000 partners and over 1,000 countries participated in this event. It is a day set aside to create awareness, to empower people around the world to recognize and, of course, help prevent life-threatening blood clots. So this is a disease that have to do with the blood. Thrombolysis, watch your television set, the name is there. All right, we have somebody in the house who is going to be talking to us today on this topic. So please join me as I make welcome Dr. Omolara Awodo. She's a professor and consultant hematologist from the University of Benin. It's nice to have you join us today.
Thank you so much, Adesiwa, and thank you for having me.
You're welcome. You say thrombolysis, I hope I got that right, is something that a lot of persons don't talk about. Until I started researching on it, I didn't know that there was something like that. You know, we'll just say, okay, blood clot, blood clot, blood clot. But what does it mean? So tell us a little bit about this.
Yeah, thank you so much, Adestuya. Yes, like you rightly said, yesterday was World Thrombosis Day, and it was actually particularly set aside to draw attention to thrombosis. And like you have said, many people don't seem to know much about thrombosis. Unlike awareness about breast cancer, HIV, AIDS, and all that. And the interesting thing is that thrombosis is about 1 in 4 persons die as a result of thrombosis.
1 in 4 persons?
Yes, thrombosis-related event. And then venous thromboembolism is now the 3rd most common killer of the cardiovascular related events. So when we talk about thrombosis, thrombosis simply means blood clots, formation of blood clots within the blood vessels. Basically, the blood vessels is supposed to be very patent, opened, and to allow the free passage of blood. When the blood components, when they clot, they come together, we call it clotting. And the danger of it is that when the blood clots, it gets attached to the blood vessels, and then it can detach or break away from the wall of the blood vessels and then enter the bloodstream, and from there it could be carried into the lungs. And when it gets to the lungs, it could block the pulmonary circulation, and that could be very fatal. And so that is really the danger of thrombosis. And that's why...
So what are the causes of thrombosis?
Yeah, there are quite a number of causes. Basically, it is a kind of interaction between what we call the clinical risk factors, which we will discuss shortly, and then the congenital, or what we call the inherited risk factors. So there are some conditions in which there are things that could cause inherited predisposition to thrombosis formation, and then we have some acquired factors. And when we say acquired factors, there are things you are not born with, that within the environment you get. And then with good examples, we have these risk factors have actually been divided into the high risk, and then the moderate risk, and then the low risk. Now, among the high risk is hospitalization. And that is why, again, thrombosis is very, very important.
Hospitalization?
Yes, hospitalization. So it's been discovered that about 60% of diagnosed cases of venous thromboembolism, they have history of either current or recent hospitalization. Okay? And so hospitalization is one of the high risk factors. And then the other high risk factor is surgery. Operation. Okay, so recent surgery, and there are some surgeries that are really particularly prone because, again, the type of maneuver, the duration of surgery, so all those factors come into play, especially...
Let me take you back a little bit. You said hospitalization is a risk factor.
Yeah.
Can you just explain that?
Okay, so what I mean is that if one gets hospitalized for...
as in you are on admission.
You are on admission,
let's use the language that everybody will understand.
All right, thank you. So if someone is on admission, the fellow's risk of having venous thromboembolism increases. And the reason is that while someone is on admission, first a condition takes the fellow to hospital, isn't it? Remember earlier on I said it is an interaction of these risk factors. So let's say, for instance, somebody is admitted for surgery. I've also just mentioned that surgery is also a risk factor, especially hip and knee surgery. And then this fellow, within that period of hospitalization, is not really very mobile. Okay, so immobility is again another risk factor. Okay, so prolonged immobility. So you now look at the fellow that is hospitalized, a condition has brought that person into the hospital. That condition itself may be prothrombotic. Okay, maybe cancer. The fellow can be hospitalized because of cancer. Could be hospitalized because of acute infections like pneumonia, like cardiac failure. Those are also themselves risk factors. So when you now put everything together, it makes the person that is on admission more at risk. And so globally, it is discovered that up to 60% of diagnosed cases of VTE, that is the short form of venous thromboembolism, actually have history of either recent hospitalization, or they are within they are still undergoing admission. Okay, so those are the risk factors. There are other risk factors that are associated. Overweight or obesity is a risk factor, especially when the body mass index is more than greater than 30. Okay, is a risk factor. Then long distance travels. The long distance travels could be either by air or by road. That any traveling that is usually more than about 8 hours, 4 to 8 hours at a stretch. Some people have reduced the duration to about 4 hours. There is an increased predisposition to thrombus formation, and finally the fellow may get thrombosis. Okay, and then cancer. All right, so individuals that also have cancer, cancer in its own also is a predisposing factor to thrombosis formation. And then people also undergoing chemotherapy, that is people on treatment for cancer, they also have more predisposition to thrombosis. Okay, I mentioned earlier that there are some inherited risk factors. Basically, the blood remains fluid, that is in a liquid form, so that within the blood vessel, within the circulation, so that blood can move freely. And there are checks and balances that the God in His infinite mercy has put there, so that makes sure that this blood remains fluid. Okay, so we have some things we call the procoagulant factors, that is things that encourage blood clotting, and then we also have things that discourage or prevent blood clotting. And so at any point in time there is a balance, all right, so that the blood remains in a liquid form and can easily circulate. So if we now have a decrease in some of those things that prevent the clotting of blood, then the blood could clot. And some of these things are inherited, okay? And again, not on their own. If somebody has that inherited predisposition and they has now had these other acquired risk factors like maybe malignancy, even trauma, like road traffic accidents, armed robbery attack with gunshots and all that, the fellow is hospitalized, all these things put together, we increase the person's risk of venous thromboembolism. And the October 13 was actually chosen because, yesterday, because of the person, and his name is Rudolf Virchow, and he's a German physician. He's also a politician. In fact, he said that it's one of the most influential physician that ever lived. Okay, and so he was the one that gave us the description of how a thrombus is formed. All right, and so because of that, October 13 is his birthday. And so October 13 was chosen as the World Thrombosis Day.
That's quite huge. Now let's look at the symptoms.
Yeah.
You know, what are the symptoms?
Okay, thank you so much. Regarding the symptoms, now the main thing about thrombosis is that the symptoms are not specific. And I will give you an example. And that's why it is, again, dangerous. Because if there's no specific symptom, then the danger is it could be overlooked. Okay, the doctor may not suspect it, may think of other things, and before we know it, we remember we said that the clot can detach and move to the lungs, and which is actually the danger that we don't want to happen, and that can happen if it is not suspected and diagnosis is made on time. Okay,
before the symptoms, how do you diagnose it?
Okay, so diagnosis, depending on whether it's the pulmonary embolism or the deep venous thrombosis. So for deep venous thrombosis, what we do first is we use what we call a clinical risk assessment tool. All right, so a patient comes, there are some things you look at the history, those risk factors that I have told you. And then the other thing is, so in the history you want to look at, has this person had a recent surgery? Has he been recently hospitalized? Is there an ongoing cancer? Is the person on chemotherapy? And then has this person suffered a blood clot before? Or is there any member of the family that has suffered a blood clot? So we put all these factors together. And then once you analyze, when somebody has more than like 3 or 4 of those risk factors, then you have an increase in what we call a clinical suspicion, and then you have the person to go and do an ultrasound. So ultrasound of the leg, and it will show the veins of the leg, and then it will show where the thrombus is located. Yes, that's how we make diagnosis in this environment. Okay. All right. So
the symptoms, we're going for.
Okay, so for the symptoms, basically, the patient can come with, for deep vein of the legs, for deep vein thrombosis. Most of the time, it is thrombosis within the deep veins, but most of the time it affects the leg veins, and then the patient can come with pains in the leg. Okay.
And anywhere in the leg.
Yes, especially in the calf.
Okay.
The calf pain. Okay, so can come with calf pain or pains in the thigh. Then there can be swelling in the leg, and then patient can also complain of a kind of heaviness. All right, and then if the fellow is fair-skinned or light-skinned, you can see evidence of a discoloration. The color is changing. Okay. All right, so, and then if somebody notices that, the fellow is advised to come to the hospital.
Well, what if the person is dark?
Yeah, if the person is dark, yes, the fellow may not see, and that's one of the things I mentioned, that really the symptoms are not specific. And you see, and then there could be what we call an edema, like the swelling, you press it, a kind of a depression. Okay, so meaning that there's accumulation of fluid there, so the fellow can also have that. But if the fellow is, so the fellow is dark-skinned, all this discoloration may not be noticeable. All right, and then, so if you look at it, pain, swelling, and all that, there are a number of conditions that could present with that. Even somebody just hits the leg or something, you could have all these symptoms. That's why we said it is not specific. And then there must be, the doctor must have a very, very high index of suspicion that, okay, this person may have this. And this is where good history is very, very important. Okay, and again, it may also not have symptoms at all. Okay, it may just be there, the fellow has thrombosis, and then no symptoms until there's migration, and then to the lungs, and then there's now an acute problem. So those are the symptoms for deep venous thrombosis. Now, if it's on the arm veins, the fellow will present with the same kind of swelling, pains in the arms and all that. Now, for the pulmonary embolism, the fellow can present with shortness of breath, okay, and then rapid breathing. Can tell you that I can feel my heart breathing very fast, and then patient can complain of lightheadedness, and then could even have a syncope, a fainting attack, all right? And then some of them may present with coughing out of blood. Again, these are not specific symptoms because chest infections could also present like this. All right, so those are the basic symptoms.
Okay, let us look at children now, because, you know, any illness that does not really have a definite symptom is quite frightening. Then when you look at kids, you know, how does it present in children?
Yeah.
How do we know?
Now, the good thing is that it is not very common in children. In fact, it is very rare below the age of 16. Okay, so beyond that, you can begin to see them. I mean, see thrombosis, but below the age of 16, it is rare. But there may be things that could predispose to them in children, like drugs. Certain drugs may cause thrombosis in them. Okay, but in that case, the doctor is already aware that this is a likely complication that this patient may have, and it's watchful. It's watching out for it. Okay. Yeah. Then you mentioned something about the different types.
Yes.
Yeah. So basically, we have what we call arterial thrombosis.
Arterial thrombosis.
Yes, or venous thrombosis.
Where do you get that one?
Yes. Again, the risk factors, those ones include something like diabetes, mellitus, hypertension, and that is, so you discover that people like that, they have what we call the formation of plaques, arteriomatous plaques within the arteries, okay, and those are the people who have atherosclerosis, and those ones who have ischemic heart attack, all right? So you find out
to be very careful.
Yes, so it's a form of thrombosis, but again, more people are more aware of that. So people know more about heart attack than they know about venous embolism. So that is fairly more common to people, and so they have cigarette smoking, obesity, they are aware of the various risk factors and then what to do. So in times of, but for venous thromboembolism, the awareness is not as much as that of arterial thrombosis.
I think we're going to do plenty of awareness, because since you have said that it is life-threatening, one has to be very careful about this. Now let's look at, is it something that can be treated? Is it curable?
Yeah, so the good thing again about it is that, and that's why awareness needs to be generated, okay? Because it is actually about 60% again is preventable. Okay. So if you are aware of the risk factors, we just said hospitalization is key. That up to about 60% of diagnosed cases, they have history of recent hospitalization, or they are even still on admission.
Because they've been in a position for too long, no activity.
Exactly.
So they need a lot of activity.
Exactly, and then coupled with the conditions that brought them to the hospital, those conditions themselves may also be pro-thrombotic, and so all the things, the various risk factors interact together to promote thrombosis in them, and so it can be prevented. And once we talked about risk assessment. Remember, I said those two when you were asked about diagnosis. We take a good history. The doctor will take a good history and estimate the risk of this patient. Okay, and so there are various tools that they use to estimate the individual's risk.
Let me just pause you there. We'll come back to treatment again after this. All right, guys, you're watching the program Healthy Living on ITV, and we're looking at thrombosis. The sad thing is that the awareness on thrombosis is very little, but we're doing our own here to make sure that you get to know what this is all about. And then if there are risk factors, if you notice anything, the first place you run to is the hospital. Health is wealth, and life does not owe you good health. You owe it to yourself and to your family. So don't just sit there and think that life will give me good things. No. You will have to earn it. You must have to take care of yourself. And then, like from what Dr. Malara would have been saying, sedentary life is dangerous. You need to involve in a lot of activities, okay, so that you get your body moving. The number to call is 052-290-573. 052-290-573. Please call Dr. and let her give you answers to all of your questions. If there's anything that is troubling you, it has to do with your blood, okay? I know somebody will be wondering, blood clots and all that, how does it happen, where does it happen, how will I know, what will I do? All of these are questions you should direct to Dr. Omolara Awodo, who is a professor and a consultant hematologist from the University of Benin. Yesterday, 13th of October, was set aside to create serious awareness, and over 100,000 countries participated in this. Over 1,000 countries participated in this event, and little or nothing was said about it here in our country. That's why we are bringing this to the fore. We had World Egg Day, what that day, but World Thrombosis Day, there was so much quiet about it. So, doctor, before we go to treatment, let me task you on this. Apart from what we're doing here now, are there handbills? Yeah. Are there posters? You know, like town hall talks on this issue? Are the secondary school students aware, the universities, the undergraduates, the market women, you know, what is the awareness rate like?
Okay, thank you so much. Well, there's really not much awareness for now, but I will tell you what has been done. The Nigerian Society for Hematology and Blood Transfusion, we had a press conference, I think on Friday, and then to create an awareness, the various risk factors, and then the need to be proactive was actually well discussed, and it was circulated in most of the major newspapers, online newspapers in Nigeria. And then there's this company that the society approached, and that's Sanofi Nigeria.
We'll try not to call them.
Oh, I'm so sorry.
No, you're okay.
So the company supported us, and then in creating this awareness, and then so there was a press conference on it on Friday, and then different locations, like we are doing our own in Benin here, they try to do a road show or do some kind of presentations to the hospital community, because like I was saying earlier on, that it can be prevented, at least for those people that are coming to the hospital. Even the hospital community needs to be aware that this risk exists, and so, and if the risk exists, so what do we do to avert thrombosis?
Okay, let me before we'll talk of treatment, let me take you back to this issue of somebody being hospitalized and stuff. If somebody is on a hospital bed, how do you help that person so that the person does not come down with this? Because sometimes the person is just there. Yeah. You know, you can't move about. The person is kind of confined to that small bed, and you know.
Yeah, thank you. Yes, thank you so much.
We need to know how.
Yes, that's where we talk about being aware. Not only is the doctor aware now, the patient also has to be aware. And so if the patient is aware, it is the patient's right to know his or her thrombotic risk. Okay. And so a patient that is going into the hospital should ask, doctor, what is my risk of admission?
Unfortunately, people don't ask questions. They just stay there and say, okay, I'm sick. You're just there on the bed and you don't ask questions. And how
and then you were talking about what we are doing. Yes. We are doing. So, and then in UBTH now, we have a program ongoing that we call the venous thromboembolism safety zone. Okay. And that what the program is all about is to make sure we sensitize all the health workers within the hospital, especially the doctors and the nurses, on the various risk assessment tools that are available. Okay, so now within the next couple of weeks, UBTH we make it mandatory that any patient that comes is risk assessed. Okay. And so once you are risk assessed, you'll be able to know whether you are high risk or moderate risk or low risk. And if the fellow is high risk, there are measures that could be taken to make sure the fellow does not develop thrombosis. Remember, when we say someone is high risk, it's just a risk. It doesn't mean the fellow is going to come down with it. But however, it is better prevented. Yes.
Okay, what about injury? Does injury have a role to play in all
trauma.
Of this?
Yes,
because so many people will just come down with one injury. The thing is, Once somebody, okay, I did a little bit of research on injury, and I discovered that people don't like to go to hospital. They say, that's small injury. Put hot water, put this, put that, and you're good to go. Oh, our fathers of those days, they used to just put like a rock in the fire. When the rock is hot, you bring it, you put oil, and then the steam and all of that. People still don't go to hospitals.
Yeah, so
the role of injury in thrombosis.
Yeah, but when we talk about injury and thrombosis, basically is the major injuries or what we call major traumas. Okay, like road traffic accidents. So those are major fractures. Those are yes, those are major traumas.
Okay, let's do the score, doctor. Hello, caller. Good afternoon, and thanks for joining us.
Yeah, good afternoon.
Good afternoon. Please tell us your name and ask your question.
Hello.
Hello.
Yeah. Please, I just want to ask. I've been listening to the program.
Thank you.
I'm here to hear about things to avoid. If there are things that one eats, maybe it's time and all that.
Okay, you're talking about preventive measures now.
Yeah, preventive measures.
Okay. All right, doctor. Even though the caller didn't tell us his name, he wants to know. All right, what's your name, please?
My name?
Yeah.
My name is Mr. Chooks.
Okay.
From Guinea.
All right, thank you for calling. All right, doctor.
Yeah, thank you so much, Mr. Chooks. Yeah, among the risk factors, we do mention obesity, we mentioned cigarette smoking, and so lifestyle modifications could help in reducing one's risk. So if you know that your weight is above the normal range for that age and height,
so obesity
then
is a problem.
Yes, it's one of the risk factors. So then it is advisable that the fellow reduces the weight, and then if the person is smokes, then of course you could try to stop smoking. Okay, and so those are the lifestyle modifications that one could do.
What about food? Can food help? Are there food that will help? Food, drinks?
Yeah, food helps with the, when you look at, again, everything boils down to weight. Anything that could help you to have a healthy weight is helpful, okay, in reducing one's risk as far as risk is concerned. And yes, then the other thing we didn't mention as risk is age. The risk also increases with age. The age older you are, the more likely the person may come down. And again, the reasons are obvious, because as one gets older, some of these illnesses, they come to, they show their faces, cancers, hypertension, diabetes and all that. So they come in, and then so all those ones, so age. And then for women, pregnancy is very, very important. Thank you so much. So pregnancy is very, very important. And then it's good a pregnant woman knows her risk. And basically the doctor should do that. And like I said earlier on, if the doctor is not offering, it's the patient's right to know, and the patient should be able to ask the doctor what it is my risk.
Okay, so I will ask you a question after that. Now, hello, caller, good afternoon. Hello, good afternoon. Hello? Okay, we lost that call. You talked about pregnancy. There are some women, when they are pregnant, they have this swelling on their legs, because we don't want to get women scared now. We don't want to get them agitated. There are some, you see their legs will be so swollen, like twice the normal size. Some can't even wear shoes anymore. They just do bathroom slippers, flip-flop slippers. They can't do any other thing apart from that. So should this woman be scared? We'll answer that question after this. Hello, caller, good afternoon.
Hello?
Hello, good afternoon.
Hello, good afternoon, madam.
Thank you, sir. Please, what's your name? Okay, rheumatism and thrombosis. Any relationship with those two?
There's what we call rheumatoid arthritis.
Rheumatoid arthritis.
Yes, those ones also increases any conditions that any infection or inflammatory condition also is a risk factor for thrombosis. So but like what we are saying is that all these risk factors interact. And then we may have in some people that have all the risk factors, they don't come with thrombosis.
So don't get scared.
So they are all risk factors. And so if one's risk factor is high, the doctor has said and said, yes, you have a high risk you have a high risk of developing thrombosis, then you just aim at preventing it from happening.
So that it does not happen.
Yes, yes. So it's an interaction of risk factors.
So it's not simple. You have a high risk factor and then cause for alarm. Not really.
Yeah.
Hello, caller. Good afternoon.
Hello.
Good afternoon. Please tell us your name.
Hello.
Hello. Okay, we've heard your voice. What you do is reduce the audio level on your television set, then call the doctor. Hello, caller. Good afternoon.
Hello.
Yes, good afternoon. What's your name? Please tell us your name.
Hello. Good afternoon.
Good afternoon. I can hear you. All right, 052-290-573 is the number to call, and we are discussing thrombosis with Dr. Omolara Awodo, a professor and a consultant hematologist from the University of Benin. Hello.
Hello.
Hello, good afternoon.
Good afternoon. My name is Emmanuel.
All right, Emmanuel, ask your question.
I'm the one that asked the question just now.
Okay. Rheumatism and thrombosis.
Thrombosis and rheumatism.
Yes.
Any connection?
Any connection? The doctor was trying to explain to you. I'm not sure you were listening. So, doctor, once again, any connection between the two for Emmanuel?
Yeah.
I'm sure I wasn't listening.
So we call it rheumatoid arthritis, and any infection from anywhere in the body is actually one of the risk factors, okay? And I said they are all interactions, so it does not mean that you just have one risk factor and then you are going to say, oh, I'm likely to have thrombosis.
Okay, well, what is the relationship between thrombosis and
you asked a question earlier on
about pregnancy? No, we'll bring that.
Okay.
I didn't want to forget, so
atherosclerosis.
Atherosclerosis, yes.
Yes, atherosclerosis can lead to arteria. Remember I said we have two types of blood vessels. We have the veins and the arteries. Yes, so the plaques within the arteries, those ones cause atherosclerosis. They could lead to arterial thrombosis. And yes, and I said those ones could lead to ischemic heart attack, and they are more common, they are well known. So when you mention something like heart attack, everybody, they know. So it is a cause, atherosclerosis is itself a cause of arterial thrombosis. All right, and then the risk factors, more or less, they are the same, but with different peculiarities. So obesity, cigarette smoking, hypertension, diabetes mellitus, those ones are more for, and then high
what about somebody
lipid
who suffers from high cholesterol
That's
levels?
it. That's what I'm saying about high lipid, high cholesterol levels. So those ones tend to increase the chances of developing atherosclerosis and then arterial thrombosis. You get the difference now.
Okay, yeah.
So the vein is the one that is basically not as popular of the trio, all right, as the that of arterial thrombosis. So we have
so much to learn about one's health. Plenty. The best thing is just to have a good lifestyle, you know, good and healthy lifestyle. I think one will be able to, like, you know, get away from all of this. All right, hello, caller, good afternoon.
Hello.
Hello, good afternoon.
Good afternoon.
Tell us your name, please, and ask your question.
All right. Chief John Amoebe.
Okay, Mr. John.
Okay.
What's your question? All right, John Moegba is there. Okay, going back to pregnancy, women with swollen feet during pregnancy.
Yes.
Let's not get our women very scared now. Yeah. Does it have a relationship?
Yeah, so it's one of the challenges of VTE, this deep vein thrombosis in pregnancy, because really swelling of the legs, and they are part of the normal physiologic symptoms of pregnancy.
But not in every woman.
So again, the way with things differ in everyone. Okay. So, and it makes diagnosis challenging. So the challenge before the doctor now will be, is this thrombosis, or is this person developing thrombosis? Does she have a thrombosis, or is it just the normal normal symptoms of pregnancy? Now, the thing to do again is this risk assessment. Is patient has pain, you look at family history, and if the person's, the doctor's is still of the opinion that this may be thrombosis, then the doctor can send the patient for imaging of the leg, ultrasound of the leg, to check whether it's actually thrombosis.
Okay, doctor, in layman's language, can you just tell us the things we should prevent? Let's itemize them, because I know quite a number of persons are watching, and the only thing that person is waiting for is how can we prevent all this baby grammar that doctor has been talking about. So Dr. Malara Awodu is going to tell us one by one in our language what we should run away from. Hello, caller, good afternoon. Hello? Hello? Good afternoon, caller. Okay, please don't engage our line if you don't want to talk to the doctor, okay? Just call only if you have questions to ask. If you don't have any questions to ask, don't bother, you know, making the line busy unnecessarily. All right, doctor, please tell us
so one by one,
what we should avoid, how to prevent thrombosis.
Okay, I think the first thing is to be aware, and then to know the various risk factors we have said, we have outlined, and then we mentioned something about prolonged immobility.
Yes.
If one finds oneself in a situation where you will be mobile for some
persons
hours.
just travel for like 16 hours.
Yes, so the advice for that is for you to engage your leg. You try to move your leg around while you are on a long haul flight, and then try to drink as much water as possible.
Okay.
Dehydration is also a risk factor. So we need to keep ourselves hydrated, to drink a lot of water, and then lifestyle modification, you mentioned it earlier on, just try to be as healthy as possible. If you think you are on the overweight side, try to get back to the normal weight for the age, and then for the height of that of the person. And then the other thing is also to, if one close family member has thrombosis. Remember we said there are some cases we call the inherited predisposition to thrombus formation. The person should be able to really ask questions and then find out, if need be, to do testing to be sure that he or she doesn't carry that gene that could predispose to that. And then women on contraceptive pills, especially estrogen-containing contraceptives. So, but basically, before, if the person is getting it from the hospital, before it is given, there's usually a lot of questions they need to ask, okay, because estrogen-containing contraceptive pills, or hormone replacement therapy, especially for women that are post-menopausal, they try to use some of these drugs, and then they also predispose to them. And it's not that every woman that takes all this will come down with it, but you need to put all the risk factors, because the more the risk factors, the more the likelihood of developing thrombosis. And so if you know that, yes, you have all these other risk factors, and then like these contraceptives, hormonal contraceptives or hormone replacement therapy, it could be avoided, or you look for an alternative that doesn't have that kind of side effect.
That can only be possible if the person goes to the hospital.
Because
we've come to find out that, oh, my friend is using this particular contraceptive, let me use it if it's working for her, without really asking questions if that particular drug will be good for that person. You see why you must go to the hospital to get proper medication. So you see a doctor, and then the doctor will tell you what to do. Don't just use drug A because Oveseri is using that drug and then you use it, because that person is using, particularly women who are using, you know, contraceptives. All right, doctor. So, and apart from that, what else should we do? You know, sometimes they say, eat well. When you eat well, you'll be fine. Are there some food one should avoid? Hello, caller. Hello? Hello? Hello, good afternoon. Hello, good afternoon. Okay, let's look at fruits and vegetables, because when you go on the net, they say eat this particular food, eat that particular food, particularly ginger. Like while I was researching for this topic, there was a place I found that said, oh, just consume ginger. You wake up in the morning, you do ginger drink, you do that, and you keep wondering, what is the relationship between ginger and thrombosis? Now, are there fruits that can help or add to one's problem?
Yeah, well, again, fat-containing food, because anything that's going to increase blood cholesterol level can also cause problems and issues with thrombosis. And so we should try to limit too much fat, okay? And then fruits and vegetables will never go wrong.
Okay.
So again, it still boils down to healthy lifestyle. You eat well, you rest well, you drink a lot of water, at least on a healthy platform. If other things come, it's at least that side of risk factor will be removed. It's not going to be added to the other risk factors. So plenty of vegetables, plenty of water, and then fruits. The one can never go wrong. So
good, healthy, good lifestyle is just good for you.
Yeah.
Avoid alcohol, food that would increase cigarette smoking and all that.
Yeah.
If you're diabetic, you have to be very careful and make sure you do all that you need to do. If you're overweight, drop some. It's not fashionable. And what else? It will kill you if you're not careful. And then, okay, we talked about high cholesterol and all that. All right, doctor, I'm hoping and praying that come 13th of October next year, the awareness is going to be bigger than this. And we don't have to wait until October 13th, because you did say that 1 out of 4 patients will die as a result of thrombosis. That's quite huge, 1 out of 4. So for us
people that die, 1 out of 4 people that die is because of thrombosis. Yeah.
All right, so if we keep to all of this, I'm sure we are just going to be very safe. So the awareness will not end here. So we're hoping that, you know, from time to time we'll call you, we'll talk a little bit about this so that our people will be aware, so that we don't die for lack of knowledge. All right, Dr. Molara Awodu, thank you very so much for being part of us on the program today.
Thank you so much, Adisa.
And for those of you who have been trying to call, don't worry, maybe next time we'll bring Dr. Molara Awodu again to come and talk to us on thrombosis. It's something that has to do with your blood. So avoid all of this and you will be safe. Life does not owe you health. You owe yourself good health. We'll see you again. Bye-bye.